Hello, everyone. My name is Mark Haskelson. Thank you so much for joining us today for a part of our free education webinar series. We hope that you will find this today educational and hopefully not too scary. When we do these things, unfortunately, we are talking about the fines and how people got in trouble for doing things wrong. But our real goal of today is to show you the things that what you could have done differently, or how you could have followed the law, protected yourself, protected your patients, and avoided all of the potential problems I'm going to show you about. So for those of you, if you have not been part of our webinar series before, today's webinar will be recorded. It will be available on our website usually about 24 hours from now. So tomorrow or at the latest on Monday, you'll be able to view a recording of this webinar, and or if you want to grab a link to share with your friends, please feel free. We do have a whole bunch of free resources on our website. They are truly free. We will not harass you. So if you're looking for white papers, articles, infographics, HIPAA compliant facts, cover sheets, that kind of thing, please do feel free to go to our website and download them. For today, as I'm going through today's webinar, I do encourage you to ask questions. So questions are valuable and interesting. Hopefully it'll make it more exciting for the folks, for all you folks listening to me. You can ask them anywhere along the way. I'll do my best. Sometimes when I'm presenting, it's hard for me to stop in the mid of a slide, so I will definitely get to them at the end of the webinar. If we do happen to run out of time, please be aware that any of the questions that were unanswered, myself or someone on my staff will follow up with you and get you an answer to the question. Every once in a while, there are some questions, depending on how complex they are, I save them for a follow-up offline. So one thing before I get going, I'm generally curious on the folks that are on the call. And the question I'm going to launch is I'm going to launch a poll. And the question is, are you a covered entity or a business associate? So if you guys could take a second and just answer that. If you don't know what a covered entity is and you're not sure, a covered entity is anybody in healthcare who's involved with payment, treatment, or operations. Business associates, on the other hand, are all the vendors that serve the wonderful world of healthcare. So, and if you are not sure, we do have occasionally find some folks that actually fall in the both or an unsure category. So please don't be embarrassed if you're not sure. That you're welcome to fill that out. All right, so we have I'll let you guys finish that. By the way, this is the only poll for today. So I'm going to close it out in a second. Anybody else want to jump in there? If not, I'm going to close this out and then share the results. Okay, so I'm going to close it out now. Now, let me share this. So what's kind of interesting, and this is not that unrepresentative of the market. So of the folks, there's a couple hundred of you on this call, 60% or 61% of you are covered entities, which means you are somebody who's directly involved in serving a patient, or you are in the business of insurance. Okay, which means you are the actual insurance company, not a broker, not a billing firm, etc. Business associates, well, that can be so many things. That can be a billing company, that can be a transcription service, an EHR, an MSP or an IT provider, a lawyer, accountant, etc. So it does help. For me, for this particular. Thank you. I had one of the folks was kind enough to point out that yes, there are some people that are both, and that means you can actually you can very much be both. So thank you for pointing that out. We appreciate it. All right, so let's get into the meat of what is going to be today. What I'm going to do is kind of talk about. I'm going to give you just the examples that occurred this year. I'm going to give you a little bit of what we would call basic, let's say, the review of the misunderstandings that we most commonly see in the clients that we work with. And for those of you, if you are not a client of Compliance Group, this type of webinar is actually open to the market. So we do have a mix of both our existing clients and lots of folks that may just be coming here for educational content. So if you are not familiar, and I share this with you to just give you a sense of scope and scale of who Compliance Group is, we are in the business of simplifying compliance for both covered entities and business associates. So we're a tool to help people do that. As I go through these examples, whether you think we're smart or not, do understand that we serve over 70,000 organizations, and in 14 years, we have never had a client ever fail an OCR or CMS audit. Now, by the way, that doesn't mean we haven't had lots of clients get in trouble. People have lost laptops, massive breaches, etc. So it is what you're going to see as I go through today's webinar is the concept of how you prove your good faith effort to have satisfied this law. Okay, so we are endorsed by most, or let's say more than half of the medical specialties in the United States. We do a lot with consultants and technology providers. We do an awful lot, and one of the things I'm going to talk through today is the very important intersection point in between what is both compliance and security. So often we see people who think that they've done some great work on the security side. That's awesome. That does not make you compliant. And on the flip of it, even if you were 100%, even if you did everything that was required under the, let's say, HIPAA law, that doesn't mean you're really as secure as you should be, okay, or they're as secure as you might misunderstand and think you are. Okay, it really requires both, because there's the combination of what is the human error and then the technology. Okay, so and what you'll find as we're going through the explanation, there's a lot of concept here under what is considered effective compliance. Right, based on who you are and what you do, did you do let's say, enough of what was necessary? Okay, so let's keep going. So first off, I'm going to do a quick high level of the law. Now, the reason I do this is if the current failure rate of over 90% of people who get audited fail their audits under HIPAA. CMS also has some very high failure rates. OCR, by the way, just to make sure if I'm not using too many acronyms, OCR, Office of Civil Rights. That is the enforcement arm of HHS, Health and Human Services, that if you do undergo an audit, or when you undergo an audit, it's probably a better way of thinking about it in today's world, that is who you are going to face. Okay, CMS, which is for let's say our covered entities in the crowd, those are folks that are involved with the testing from what was meaningful use, now macro MIPS. And an important intersection point is we'll talk about why some of the misunderstandings we see. But so first off, if you are a covered entity, the privacy rule applies to you. Okay, does not apply to a business associate, although a business associate does need to support their healthcare clients or their covered entities if there is a question around privacy. So this is the standards of how you can discuss PHI, or protected health information. Okay, so, or personal health information, depending on how you want to refer to it. We see folks using it a couple of different ways. But in the end, this is what, how you as a doctor or your nurses or your staff are talking to your patients. The security rule is where we see some of the big misunderstandings in healthcare. Okay, so what often happens is most people think that doing the security or technical audits, which are 2 of the 6 required audits every year, makes you HIPAA compliant. That is not correct. Okay, it is an important part. Doing those security and technical audits are an important part of your HIPAA compliance. Why the misunderstanding under the security risk assessment item was often it was organizations were in their attestations for what's called meaningful use or macro MIPS, it called for an SRA to be done. Now remember, the law, HIPAA as a law, has been around since 1996. Meaningful use is actually an 8 or 9-year-old incentive program to improve the quality of care in the United States by having doctors electronify their records. So that is why they presumed you would have had your security risk assessment, your security and technical audits, because you were always supposed to be HIPAA compliant. And therefore, we presume that at any time you would be able to present your security and technical audits. So that's the easiest way to think about that. The problem is, and when I start going through the real world examples, okay, so I'm sorry, a couple of questions came in. I just want to make sure. Okay, just want to make sure that keep sending the questions, folks. Just want to make sure that everyone can see my screens, that kind of thing. So, okay, now what happens is, though, the rest of the audits that are required every year fall into the categories of physical, administrative, and privacy. Now, one of the problems with HIPAA as a law is it's called a gray law. It has to apply to everything from a small little medical practice to the largest of hospitals and/or technology providers in healthcare. Okay, so. What you will find is many of the terms some kind of overlap a little bit in some ways, like privacy audit being mentioned twice. It's called a high-tech subtitle D, privacy audit. But the problem is, what you will see as I go through the examples of fines, almost all the fines levied, although they may have been caused by a technical reason, Okay, someone lost a laptop, a device, someone who was hacked, ransomware, etc., which you're going to find time and time again, the fines always revolve around failure to assess your risks, failure to have policies and procedures, and failures to have business associate agreements in place with the vendors you work with. Okay, so that's why I'm going to talk, as I talk through this, it's so important. The last rule that you have to be involved with, and it is probably the reason why most of you are on the call today, and that is what's called the omnibus rule. So the omnibus rule was put into effect or enforcement at the end of 2013. It had a 2-year grace period, but here, and now this is why you're seeing it, why there is a 400% increase in fines and audits, revolves around the omnibus rule. And what the omnibus rule said is a couple different things. One, all the vendors who serve covered entities have to be HIPAA compliant, just like their covered entities. Okay. Now, barring the privacy rule, a business associate, so someone who provides a service to a covered entity, something that the covered entity would have done themselves, where PHI is either being moved, stored, or interacted with. So, for example, a billing firm is definitely a business associate because they are doing billing for you, right? They're doing something the doctor would have done, okay, or the doctor's staff would have done. A cleaning service, on the other hand, is not. Why? Although they are servicing the medical professional, is the definition of what they're doing. They are not coming in contact or should not be working with PHI to do their job. Okay, so enough of the little covered entity BA thing. Now, what happened under the omnibus rule had a direct effect on both covered entities and business associates, because before you could share PHI with somebody, you had to do two things. You had to have a business associate agreement. Now, by the way, covered entities, when they outsource to a vendor, have to have one, and a vendor or a business associate who outsources potential work to a vendor. So, for example, you might be using a piece of software to do what you're doing. Then in that case, that software provider also needs to be able to prove their HIPAA compliance. They're a business associate to you, even though you're already BA. Now, what's required in that is a business associate agreement. A BA agreement is required, and what it should say, by the way, for people who are, especially for our vendors on the call today, business associate agreements are good for both parties. Okay, they actually reduce the liability, in my opinion, in between the two organizations, because what they're clearly stating is both organizations have agreed to be HIPAA compliant. That's the federal law. And that each organization is responsible for its respective breaking of that law or satisfying of that law. So it really helps the government be able to say, look, something went wrong. Whose side of the fence did it happen on? The side of the fence that happened on, they get fined. Why this is so critical is if you study what is, and I'll talk about the wall of shame later. These are meaningful breaches that are reported to the U.S. government. Over 30% of the breaches were caused by the vendor. Okay, that person you hired to protect you, unfortunately, or whatever service they were providing for you, they did not have the correct security protocols in place, or they were not HIPAA compliant, therefore didn't have the right administrative policies and procedures in place to protect your information. Okay, so BA agreements are good. The other thing you need to have, and actually this is there's a couple examples in this year's enforcement efforts, you need to have what's called a technical due diligence. So whether you're a covered entity outsourcing to a vendor or a BA or a business associate outsourcing, you are not responsible to see whether or not your partner is HIPAA compliant. Why? Only the federal government gets to decide that. Okay, only the auditors get to decide whether or not you satisfied the law appropriately. So what you are responsible to do is to make sure that you've done a good faith effort to investigate or confirm that they have correct security protocols in place. So in other words, if you're sharing PHI in an electronic form, these folks are not going to lose it, put it in the wrong place, share it, not be able to protect it, get ransomware, whatever it may be. Okay, so now let's get into the 7 fundamental elements. Now, one of the other big misunderstandings that a lot of people have is that they are very proud of the technology they put in place. And we, for example, we partner with hundreds and hundreds of what is called MSPs or security organizations, and that is fantastic because, as I said earlier, you cannot be compliant if you are not secure, and you cannot be secure if you are not compliant. So, but let me explain how the federal government enforces the law. Okay, we're also going to talk later today about how state attorney generals are enforcing the law. That's kind of a new uptick, but you definitely should be aware of it, and we'll talk through it today. Okay, so for example, I said earlier, HIPAA is a gray law. What we mean by that is some laws or regulations are very clear. There are 5 specific checkpoints you must have. Okay, in the case of HIPAA, 1, it's been around a long time. 2, it applies to a very broad set of organizations, everything from a standalone optometrist with a couple of employees to, in the eye care world, Essilor, okay? billion-dollar corporation. In the more traditional sense, it has everything from your local doctor's office to large hospitals. Same thing with the vendors, that could be a very small organization or some of the largest insurance companies in the world. Okay, so the way the government enforces it is what's called the 7 fundamental elements of an effective compliance program. Okay, so what they want to know is, did you do the basics based on who you are, the risk profile you have, to make sure that you've done a good faith effort to protect the information that you are interacting with. So the basics are you gotta have written policies and procedures. It's kind of easy. Code of conduct. Okay, somebody at your organization has to be responsible. They do not have to be let's say have gone to school for what is compliance or security, but someone in your organization has to take on the role of defending what is the PHI, okay, the information itself. You need to have effective training, lines of communication, internal monitoring, and auditing. So what does that mean? That means, and I'll give you some examples of, just because you did a staff training, 1, that may not be qualified. Okay, 2, if you would really, and this was an example from in the past, there was an Alaskan behavioral health group. They were fined for malware, not for the malware, but because they had training, but their training was done once a year and they had very high turnover, 30% or more. So the argument from the government was that was a perfectly valid training program, but because 30% of your staff turned over, you clearly had people who were going potentially a year or more without proper training. Now, lines of communication and monitoring auditing fall in the same category. If you're a local dermatologist and with 10 employees, what's required to monitor and audit the flow of information that you're dealing with is relatively low. But if you're a large EHR, like an eClinicalWorks, okay, where you are responsible for what is over 90,000 medical offices, you'd better make sure that your monitoring and auditing technology is up to snuff. Okay, you have to have enforced standards for well-disciplinary guidelines. So the days of, well, it's not my fault or the doctor can do whatever they want, no. There has to be something that says, you do this wrong, whether it's suspension or firing, that's what happens, and it has to be enforced. The last is under the omnibus rule is one thing. I'm sorry, I forgot to talk about. The omnibus rule is one of the changes in the omnibus rule is that if a incident or breach occurs, okay, and incidents and breaches occur in every business, sometimes almost every day, okay, you have a responsibility to investigate and then, depending what you find, take corrective action and report it to the U.S. government. Okay, so if it's more than 500 people affected or potentially affected, you have 60 days to report to the U.S. government that occurred. I will say, just my opinion, my firm is involved in 2 or 3 audits on any given month. It could be OCR, it could be CMS. So we hear time and time again, they do not expect you to be perfect, but they do expect you to be what is transparent and prove good faith effort, which means if you have a breach, don't try to cover it up, report it. Okay, and for those folks on the call who say, we don't have that, one of the simplest statistics I say is, there are statistics coming from law enforcement that says 1 in 10 people in the United States will lose a smart device in a given year. So what does that translate to? There's a pretty good chance if you got 10 employees that you will absolutely be fined. I'm sorry, not fined. You will absolutely be audited at some point. They're going to ask you for, and the type of audits, and this is a good thing to talk about before we start getting into the real world examples. The audits come in different flavors. Okay, but the basics of an audit is okay. So one thing, anybody who calls you on the phone and says, you have attested for something, meaningful use, and you must be, because of that, you have to meet with one of our auditors. That is a scam, folks. Okay, there are a couple organizations across the country that have been impersonating what is considered federal auditors. If you are getting audited by the state or by federal, you will get a certified letter letting you know that you are at a very specific list of questions that they want answered. Okay, you will never get a phone call from someone saying, "Hey, you need to get on a call with us, and we're going to step you through this." If it happens, basically get their information, have them send you something, and then report it to OCR. Office of Civil Rights, or HHS. Or to your state attorney general. Okay, so let's get into. So officially in 2018, there were $25 million in fines. And some of you folks will say, well, gee, Mark, that really wasn't that much money, right? It's not so much the money, because what you'll find is in the actual cost of fines and incidences, okay, yes, the average is 2.5 million. So I don't know how many businesses, I don't know about you. I do not have an extra $2.5 million sitting around. If I was to get audited and found, that I was negligent or misconduct, that's pretty painful, right? By the way, the other one that often happens is I don't have to worry about it. I got a cyber insurance policy, or I have an insurance policy in some fashion. Do understand and read the fine print. It's not even fine print anymore. It's actually probably big bold letters. If you cannot prove that you are satisfying all applicable laws, they do not pay. Okay, you cannot blame them. If you didn't do the basics to protect your organization, why should they have to pay for your negligence? So the other thing I'm going to talk about with fines is fines are the actual fine is really only about 10% of what is the impact to your business. What really hurts a business, 90% of what is the cost, okay, both opportunity and real dollars, is the impact that it has on your organization. So yes, if you do get fined, you have a corrective action plan. You pay your $2.5 million because you have that much capital. More power to you. The problem is you now have a whole bunch of rules you got to follow. Right? So now, for one thing, you have to, in most cases, you have to notify all the people affected. So as you can imagine, if you tell your clients and or patients that, oh, by the way, due to my negligence, I was fined a bunch of money for not protecting your information better, do you think they're going to stay with you? Probably not. Your insurance company will most likely raise your rates, if not revoke the policy itself. Your bank may revoke your line of credit. The cost of fixing this runs about, the basic numbers are roughly $250 per record, so per patient or per client, to notify them and take the appropriate actions. So what the last one that I think is important to understand is class action lawsuits. If you've had a massive breach, don't be surprised that there are a group of folks that were negatively affected are going to get together with a lawyer and sue you for a big chunk of cash. Okay, so the actual cost of it is not the $25 million in penalties. It is 10 times that in what would be the actual indirect costs of having to undergo an audit and ultimately be found that actually you might undergo an audit and prove that you were not fined. But either way, there's still all that time, money, and effort and the whole issue. Okay, so let's kind of step through some of the 2018 fines. So one of the ones was shred it or lose it. Okay, in this case, Filefax they did a bunch of things wrong. Okay, they had left doors open. They left material. They left boxes of material that was supposed to be shredded on bays, and in one case, they left an unlocked truck in a parking lot where people broke into it and took the information out. Okay, the fine was relatively low because during the investigation, basically Filefax was considered so negligent. They did not. This is a great example of the $100,000 fine would have been what hurt them, but the overall risk of what they did was enough to force them to close their doors. Okay, they actually filed for bankruptcy and shut down. Okay, so as I said, they were very careless. The commentaries from. By the way, if you don't know who Roger Severino is, he is the director of OCR. So he is the person. It is his staff who go and audit you. All right, and for example, those 7 fundamental elements, that is the official guidance by the Office of Inspector General and HHS. Okay, so those are the guidelines. So in the case of Filefax, they were just incredibly sloppy. They did not follow even in the most basic of functioning of HIPAA. And listen, folks, For all the folks, often I hear doctors and businesses, it's not that big a deal. Let them catch me. Well, in this case, this caused this business to shut down, even after they were closed. The level of negligence was that the judges involved agreed that whatever assets were going to be recovered, that 100,000 of it had to go to the U.S. government to represent. Okay, so don't presume that you're going to survive this thing. In the world of social media, and we all, that is very common for us. We're going to do a little podcast, or we're going to walk around our office and with our iPhone and fill some things. Do understand that last year there were, in this case, it had to do with a group. ABC was doing a bunch of different documentaries in healthcare. On 3 separate occasions, they were fined for what was, people were, these are people in an emergency room. Okay, I didn't expect if I came in there with because I cut my hand very badly that I would be being filmed for a video, for a show. Okay, a more practical example. In this case, it was just shy of $1 million. A more practical example is often folks are very proud of their newly renovated offices. Maybe they're let's say if you take optometrists, their new retail space. Do make sure if you're filming it or taking pictures that it's either your staff, right, which is okay, or that if you do have a patient in there, and remember, sometimes a lot of people forget, you might have testimonials, pictures of people on the wall, letters that they sent you, testimonials about how much they love you. Make sure that stuff is either you have permission. That's the best thing to do, is get permission from somebody. If not, make sure that stuff is properly blanked out. Because in this case, it was 3 separate times. The 3 organizations involved were each fined individually, but ultimately it was the combined fine of just shy of $1 million. So, can't report that doc. All right. So in this case, and there's a couple of situations I can talk about this in the past. This was an argument, or basically a disagreement, in between a patient and a doctor. The patient went to the news media. We're out of New York, and you have the local radio stations are there to defend you if you're not getting good, if you're getting kind of taken advantage of by a local business. They go and they investigative reporting. The problem was, in this case, the doctor, when contacted, discussed information about the case publicly. Okay. Now, so one of the things, and I stressed this in another webinar about social media. Be very careful. Even if the patient says something good or bad or right or wrong, you are not in a position to confirm or deny that unless the patient specifically gave you permission. All right. So in this case, use and disclosure documents are very important in your offices as covered entities. So that's specific to the covered entities because you're in payment and treatment. So do make sure that you either one, don't say anything stupid. In this case, because the doctor had confirmed, and this was particularly, this was an interesting one because usually the practices are defended in that if you can prove your good faith effort. This doctor was warned by their staff not to say something on when interviewed, and the person still said something which ultimately was considered negligence. So. Okay, revoke access. This is getting more into the technical side of things. Okay, this particular one was a comedy of errors. Okay, so one was actually this particular one. Let me do this one, and the next one is more entertaining. Okay, so what happened was an employee left. Okay, the problem was after the employee left, they never turned off the access for that employee. So they were able to continue to log in. And through that, unfortunately, a calendar got exposed. Okay. So that, because of that calendar was exposed and people were able to go see sensitive information for employees. Now, this one at $111,000 is not too bad. But in New York, there was a very large hospital fine for almost the identical thing, $4.5 million. And what happened was a contractor was brought in to do some work. That contractor, after they were finished doing their work, they left, and nobody then turned off what was that access was later used to get into and access patient information. So you are responsible to make sure that you do these things correctly. Now, in this particular case, the secondary issue here was the fact that they did not have a business associate agreement with the calendar firm they were using. So remember earlier I talked about 30% of fines, 30% of breaches are caused by the vendor themselves. So the vendor serving them, and that was this particular case was the vendor themselves, the calendar vendor, was not compliant, or they would have had, let's say, proper checks and balances, policies and procedures to prevent these kind of things from happening. So, by the way, we tried to pick ones that are not necessarily the biggest fines for you guys to see today, but really represented what is, why. Kind of like the common sense things that we see happen, on a day-to-day basis. Okay. All right. Let me just look here for a couple of questions here. Yes, there will be slides available for folks that were asking. Okay. Let me just see. Let's see. That's well, let me get the questions that are asked are good questions, but I'm going to save them to the end so we get to some more material here. Okay, so another one. BA not required. This was a really, really interesting one, okay? They were basically, this was a comedy of error on two sides, okay? The organization themselves outsourced to a billing firm without a business associate agreement. Okay, but the business associate themselves also misrepresented who they were. Okay, so in the end, you had a combination of your errors here, right? One, you absolutely need to know who you outsource to who's going to have access to PHI. Two, if you're going to outsource to them, you must have a business associate agreement in place. Okay, so what happened here was because this organization did not have any of the basics of protection things in place. Okay, so what happened was because they weren't following even the most basic, okay, of control protocols, several thousand people's records were left exposed. You could actually Google it and get access to the records. Okay, so it was publicly visible. If you knew that person's name and you just Googled it, you would have found a clickable link that would have brought you to this website where you could have actually seen all of the billing and collections information about them. Okay, that's pretty darn negligent. Okay, so now let's talk about states. So normally I would have said over the years, and I've been at this for 14 years, I would have said you have to worry about what is the federal government and how they feel about you. Okay, now what's happened is I think two things. I think one, the states themselves are beginning to be more they're looking for cash. Okay, they're a little bit more cash poor. So the states themselves are beginning to say, if we see negligence, fraud, waste, and abuse, etc., we are going to go enforce it at the state level, and they have every right to. So the current states that are enforcing penalties, and in this case, if you think comparatively that 6 states fined, let's say 20% of what of the fine level for what was the whole country. Okay, so your states can get very nasty, and they have every right to go after you for this. Okay, so let's talk about let's say what some of those were by state. Okay, so if you look at what was first one we're going to take care of, I believe this is a New Jersey one. Okay, so in this case, they were accessing records. Okay, they were doing billing and collections. All right, the problem was the way they had put the data up onto their site was completely unprotected. So it's very similar to the example I gave you before. Okay, so remember, your vendors are the people you have to make sure you use correctly. So in this case, billing firms said they were a professional billing firm. They're going to take care of everything. Unfortunately, in the end, they were actually doing a very, 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 very poor job. Okay. Now, what you'll find is what the ultimately fines were things for failing to have business associate agreements, failing to do due diligence, failing to have proper training. Because in the end, and I'm sorry that I didn't kind of highlight this in each one of them, throughout each one of these, what you will find, the fines that were levied were not for the incident that occurred. It was always for why didn't you do an accurate risk assessment? Right? Notice I didn't say just a security risk assessment. Why didn't you do an accurate or assessment of the risks of the organization? And then why didn't you have the proper policies and procedures and enforce them? Okay, that is all truly, if you look at the history of what is federal fines for whether it's HIPAA, fraud, waste, and abuse, and you get into other different regulatory categories, you're going to find it is not 100%, but the majority of the time it's not the incident. It's for the negligence of the organization to have looked at themselves and had proper protections in place. Okay, so the other one that happened here is they found out about it and they didn't tell anybody. Okay, they delayed. They tried not to report it. They were hoping that they could cover it up. Okay, so do properly vet your vendors. Okay, now medical transcription, similar fine. Okay, in this case, it was also in New Jersey. You're seeing New Jersey getting kind of litigious. Vendor actually uploaded PHI to a public server. Okay, so same idea. They were getting access. Now, this one was considered so negligent that the organization was banned from doing business in the state of New Jersey. Okay, so often we hear people saying, well, I'll write a check for a couple $100,000. I'm not going to worry about it. But imagine if your medical license and or your license to practice in a state, this could happen to a business associate as well, was revoked. Okay, how would that change the nature of one, the business you're in, and two, think of the clients and patients that you serve. Okay, so we definitely want to be a little bit more careful and ultimately, don't be lulled into believing that you've done everything that was required. You check off the box, you did what you had to do. Make sure you are making sure that the vendors you work with are equally protected. Now, nonprofits. A lot of people presume that nonprofits were protected. They are not. Actually, I can think of 4 or 5 different fines that were actually fined against nonprofit organizations. One of them being, for example, it was an IT firm that was served in nonprofits only. Fined $650,000 in 2017. But let's talk about 18. So the Arc of Erie County, or ARC. What they were ultimately fined for was for not, same thing. They didn't conduct a thorough risk assessment to understand what was going on. Okay. Therefore, they had security risks and vulnerabilities that were unprotected. This is becoming a new area. And this is the third one we talked about this year, where what happened was they were storing information, but at some point, somebody didn't store it correctly. And they ended up putting that information on, I think it was 2 or 3,000 patients. These happened to also be mental, behavioral health groups. So this was folks with special needs. So they were particularly vulnerable to let's say, to predators. Their entire file was searchable. Okay, so if you knew what you were looking for, you could basically Google it, and you could find a list of all of their members or all of their patients, what their issues were, and which, as you can imagine, this is just really horrible, right? Think of someone with special needs who's not equipped to to handle high. They were able to, people were calling them, confirming information, and ultimately, basically preying upon the folks that cannot protect themselves. Okay, so you do other ones that talked about the Alaskan Behavioral Health and their training. There was the Catholic Charities out of Philadelphia. We've seen lots of, I will say, behavioral health has been one of the areas that, for lots of different reasons, has been under a lot of scrutiny in the last couple of years. So if you're in behavioral health, I would advise you to be particularly careful about what you're doing, because it's one of the areas that the government considers a higher risk profile. Okay, so I can go through lots and lots of prior fines, but let me talk about what is the wall of shame. Okay, so what happens is if you have a meaningful breach, more than 500 people potentially affected, you have to report that to the U.S. government. That report is public record. So I don't want you to do it while we're on the call today, but if you were to see the reference on the bottom, OCR portal, hhs.gov, or just Google OCR Wall of Shame, you will find, you can search by state, you can search by type of incident, by type of practice, but you can ultimately find out, and I have been in meetings where I was presenting a snapshot of Wall of Shame for, let's say, a particular medical specialty or a geography, and I had people in the room. The most graphic one I had was an eye care. I was doing an eye care conference, an educational session. When I put it up, one of the people in the room gasped. They had just purchased that practice. and they were completely unaware of the fact that they were under investigation for a pretty serious infraction. So what you'll find collectively, same thing, whether it's business associates, whether it was malware, lost laptop, serious breach or investigation, a technology breach or a software hack, etc. The government doesn't fine you for that because they realize that you're not bulletproof. Bad things happen to good people every day. What they want to hear is that you made a good faith effort. Okay, so if you look on here, you have everything from a physical therapist who put a patient's testimonial up on the website without permission. Okay, if you look at a lost laptop for the University of Oregon was $2.7 million fine. Why were they fined? The issue wasn't because it was unencrypted, okay, although that was an unencrypted device was the issue. It was the fact that it was stolen out of a child's hands on vacation. And the government said, how could you be running a substantive organization without ever understanding that your staff regularly takes equipment off-site and that there were no rules or policies and procedures? Because in the end, what you're going to find is if you do assessments and have policies and procedures, train your staff and be able to illustrate that well, that's how you prove your HIPAA compliance. That's how you prove good faith effort. Okay? All right. So let me talk a little bit as we're coming toward the end of this, and I'll start doing questions. What is being secure and compliant? Okay, so unfortunately what we see in the majority of what is the U.S. market, and this is why so many people fail, is they do hopefully an adequate job on security. Okay, and what I mean by that is they will do a security risk assessment. Like Oregon Health was very proud. They'd done a security risk assessment every year, going back 6 years. That's what the law requires. They had policies and procedures, and they documented the remediation efforts. The problem was they weren't looking at their administrative and privacy rules. So if you look like what you're doing on the left, right, where you have done a security risk assessment, that's fantastic. You do have documented remediation efforts. You may have implemented encryption or secure messaging, encrypted email, for example, or proper backup of your data, and proper disaster recovery, encryption, etc. Those are all great, and you might have policies and procedures around it. But this is what a truly effective compliance program looks like. Okay. First of all, you have to do 6 audits. There are 6 audits that are due every year. They range from security, administrative, and privacy in nature. Once those are done, you must document the gaps that were identified and have a definitive, well-thought-out remediation plan. Now, one thing that comes up a lot of times when we talk about a remediation plan, that doesn't mean you have to have all the problems fixed. So, for example, I can talk about a client of ours in Imperial Valley down in Southern California. They lost a laptop. Okay, it was unencrypted, so they were negligent on that part. But why they were able to not be fined or considered having being negligent was they could prove, look, we've done all of the things, and I'll explain all the things in this puzzle that they did every year. And they were in the process of updating all of their computers to be encrypted, but they could only do so many in a given month. They had like 32 locations, I think. Okay, so the computer was stolen from one of the 27th location. They had only, they'd done the other 22. Okay, now about 20% of what it will be remediation will be security related. Okay, what I mean by security related, that can be technology, encryption, backup, secure messaging, and monitoring and auditing. So if those words sound like technology geek speak to you, you should definitely be looking for an outsourced, they're called MSPs, managed service providers, to help you with that. If you are in need, whether you are a client of ours or not, feel free to contact our office. We deal with hundreds, if not thousands, of MSPs across the country. We'll gladly introduce you. Now, the 80% of what's required to be compliant is going to fall into policies, procedures, and training. Okay, one mistake that a lot of people make here, okay, is policies, procedures, and training doesn't mean buy a set off a website or maybe your trade association, keep them in a binder or a disc on a shelf, and that, if we ever get audited, we'll take them out. Okay, and I can definitely go through lots of fines where that was the mistake that the organization made. They must be relevant and accurately reflect the way you run your business. Okay, now when it comes to training, a couple things about training. Training doesn't have to be a live person coming in. Training can be an outside organization, can be an inside organization. But, for example, just having a random staff meeting and talking about this is not sufficient, okay? Because here's the next part, okay? You have to have document version control and prove your employees' attestation. So let's talk about document version control first, okay? You have to prove that every year you reviewed your documents and made sure they still accurately reflect your business. Why? The law could have changed this year, okay? Or your business could have changed. The way you do it might have changed, that you needed to update your policies or procedures. Now, the last thing is employee attestation. The staff meeting I mentioned is not whether or not what you discussed at the staff meeting is relevant or not, okay? The problem is you need to be able to prove that your staff understood what they were trained on and have legally agreed to follow those rules, those policies, procedures, or training. And this is why a signed attestation or a verified attestation is very critical. And the example I will give, in our case, it is built into our platform. Every employee logs in and goes through attestation. Why this was so important was we had another pretty decent sized healthcare organization, 30, 40 locations. They had a staff member access in this case, it was her boyfriend's mother's medical records. Unfortunately, mom was not happy. Okay, she ultimately sued and reported it as a HIPAA violation. That's a pretty big violation. They were looking at a couple of $1 million fine. And what happened was, in this case, because they could prove, and in this case, the way our technology works is you can print out a report that said, look, this staff member logged in on a certain date, and they agreed, they understood, and they agreed that they were legally bound by that rule. Now, if you're not using technology like ours, you can just make sure at that staff meeting that everybody signed a document. My name is, on this date I learned this, and I understood it, and I've legally agreed to follow it. Okay, that's the kind of detailed stuff you should do. Okay, business associate management. The omnibus rule said you had to do a couple things, right? You have to have a BA agreement. A BA agreement is a legal document. It has to say, hey, we both understand we fall under federal law. We have to be HIPAA compliant, and that if something happens on my side, I'm responsible. Something happens on your side, you're responsible. Pretty straightforward. There can be other language in there, but that's the basics of what should be there. If you are looking for examples, OCR does have, I wouldn't call it a legal agreement, but it is the outline of all the information that needs to be in there. Okay. The other thing you need to do is proof of your technical due diligence. We were actually, my partner was on a call last week with HHS. Because so many people are failing audits or having their breaches because of vendor mistakes, they were asking us if we would share our vendor questionnaire with the U.S. government for them to look at it as an example of how people could be doing a technical due diligence of their vendors to make sure that they could protect the information. Because in the end, I would tell you, the auditors we come across, and I'm sure there's exceptions, the majority of them are not looking, they're not out to get anybody. What they're out to do is look at you and say, did you do a good faith effort to satisfy the law? If you did, and you can prove it, they move on. If you didn't or you couldn't prove it, unfortunately, from their perspective, you broke the law, you're in trouble. Okay, the last thing is incident management. So incident management requires that for every incident that occurs, you have to investigate. That makes sense, right? What happened, who was involved, your staff, a vendor, or ultimately a patient, what patients were affected. And then you have to report that to the U.S. government. If it is considered a meaningful breach, you report it within 60 days. If it is considered a non-meaningful breach, you report it at the end of the year, and you have 60 days. So, for example, for everybody who's paying attention here, it is coming up. March 1st is the date that you are supposed to report all of your non-meaningful breaches to the U.S. government. Okay. Now, hopefully kind of this all made sense to you. In the only shameless plug I will do as part of this presentation today, if you are looking for someone to help you with all this, what is the puzzle on the right, where it's all nice and clean and everything's taken care of for you, that's what we do for a living. We simplify compliance so you can focus on your business. Okay, so all right. Hey, by the way, if you are interested, if you attended this webinar, we will give you a PCI audit for free. But okay, let's get to questions. So I'm going to start, if you have questions, start typing them in there. By the way, also, if you are looking to just understand where you are in the curve on both security and compliance, you can download that checklist off our website. A lot of people are afraid if they fill out one that we're going to take that information and use it against you. So what we do is it's a document. You print it out. It's about 10, 12 questions. If you can answer them all confidently, you're in great shape. If you can't, presume you are not HIPAA compliant, and by all means, reach out to our pleasure to have further conversations with you about how we can help you. Okay, so let's start answering some questions. All right. Okay, so we see patients in skilled nursing facilities. The facilities ask for access to our EHR. We have multiple facilities. However, our EHR is unable to limit users by facility. Is this an issue? Okay, so there are probably other questions here that I'm not going to be able to ask you directly. In theory, if these are your employees and they are in multiple facilities and they all have their own username and login, and they are properly trained and have agreed to satisfy your policies and procedures, then it's not an issue by facility. Now, I will tell you, and I'm sure the security folks on the call here will probably groan at that particular statement is, really what you should have is limited. It should be limited by facility to the people that they're directly involved with. But I do think if you can satisfy all of the components I talked about the wheel, an auditor would not be terse with you for having the fact that you might have people that are crossing from facility to facility, but you had to have satisfied all of the other issues before you did that. Okay, so I'm going to qualify that one. Please be careful. That could be a potential thorny one. Okay, so let me start answering more of these. So let's see. Let's take a peek at this one. All right, let's make it a little bigger so I can see your questions a little more clearly. So let's see. I offer an app for clients to keep their medical information. If they email or fax that information to another person, am I a business associate? If that person shares mom's data with their other sibling, is that a problem? And can I be held responsible? Okay, so the issue here is, as whatever your application is doing, you need to make sure that whoever is using that application, that in some way, whether it could be in your terms of use, but it should definitely be something that they are well aware of who are they agreeing that information can be shared with. So, because philosophically, if me, Mark Haskelson, decide to put my medical information on a billboard on the side of my building, it's not my doctor's fault. I chose to do so. Okay, but it needs to be very clear for the people using your application that they have granted that permission. So you might have to change some of the user experience, UI, UX, or user interface or user experience, so that it is very clear to them if they choose to share information that is being shared appropriately, or that they understand that maybe it's a checkbox that says, I understand I'm choosing to share my information with somebody else. Therefore, I've given that opportunity to do that or not do that as I see fit. Okay. For a training component, would this webinar count as the annual training for a practice with one employee? This one is really about a bunch of fines, but if you are interested in getting a free HIPAA training, there is one available on our website. There's no catches, there's no gotchas. It is actually the same training that we give as part of our program. So I'd recommend that you hit up our site under the educational resources, and somewhere in there you're going to find the free training, or type in Google Compliance Group free HIPAA training, and you'll get the actual class, and that comes with a certificate, etc. So please feel free to do so. Any suggestions on how a covered entity can ensure that a BA is actually having training and are protecting our PHI as they should be? Okay, so this is an interesting question. You are not responsible for your business associates' efforts. Okay, so in regards to training and or how they're protecting your PHI, you're not a HIPAA auditor. Okay, and it's one of the reasons why even Compliance Group as a third party, we say we validate and verify you've done everything required. Okay, you cannot certify that someone else has done something. Okay, law isn't enforced that way, and it's just pretty much impossible for you to do so. Okay, so what I would recommend you do is that have a business associate agreement, and a good one. If you have a lawyer, have a lawyer vet it for you, because what it should be saying in there is that they understand that they're fully responsible for this. And then the next thing is your technical due diligence. So what you can say, and if you are technologically savvy enough, you can ask questions about what exactly are their security protocols. Okay, I will not geek out on you on this particular call, but for example, the big ones are encryption. Okay, is their information fully encrypted both in motion and at rest? Do they have proper backup? Do they have policies and procedures for their employees? Do they have adequate training? You can ask the question, you don't have to see the training. The other ones I think are critical are, if they are getting involved with any messaging, is it secure? So they have encrypted email or texting. And then lastly, the other one that I would want to know about is the kind of monitoring and auditing, right? So in other words, who gets to look at my stuff and, how do they track that? Good question though. Okay, you guys, lots of questions. Thank you. Keep asking. I'll do my best. Okay. Okay. So on the EHR question, I'm sorry that what they had asked was it was that the facility wanted access. That's a little more complicated. Okay. Now you are dealing with business associate agreement relationships, and you need to have a BA that accurately reflects that if the facility is accessing that information, that their proper requirements are being followed. If you want, follow up with me afterwards. I can give you more details on that one. That's kind of a complex one to answer on this. Okay, when we send nurses to patients' homes and contract with them via vendors to conduct particular visits for clinical trials, do we need to have nurses sign the BA, or does it suffice that we have the vendor that they are contracted with as signed? So for most cases, it is the vendor that you're hiring is responsible for their subcontractors. Okay, so the nurses involved would be their subcontractors. What I would ask for is some sort of proof of that. Okay, so that, corporate policy procedure, maybe a waiver signed by them that they actually have that in place. If they are uncomfortable to provide that for you, or they get all squirrely that you ask that question, find another vendor. Okay. Regarding physician websites, is there anything else a practice needs to incorporate besides one, HIPAA compliant from form builder appointment request, privacy policy? Well, here's the deal, folks. Technology is or is not HIPAA compliant. Okay, organizations are HIPAA compliant. Technology is secure or not secure. Okay, so, but you asked many of the right questions here, and that a lot of people don't even understand that the form builders, or the forms that are getting filled out are PHI, and therefore there are a group of vendors in the market that provide HIPAA compliant forms. So that's a great question. Okay, same thing. This is kind of a deeper one. If you want, drop me an email, and my pleasure to take a closer look at it for you. Surgeon's office insists using a single common login. I've recommended using individual domain credentials for login. Okay, so this is definitely one of our MSPs, I would assume. That is absolutely not HIPAA compliant. If you have offices, and for both covered entities and the vendors who serve them, if you have everybody sharing a login, that's a problem, especially because even worse, chances are they probably are sharing the administrative login. Okay, so as there are lots of new tools available to help simplify access to computers and stuff, but if you have an organization that is knowingly breaking the law, two recommendations. One is, hey, try to educate them on the issues. For example, you can send them to our website and we'll try to talk to them. But in the end, what they're doing is not satisfying the law. The secondary thing you can do is ask them to sign a waiver. Right? This has become more common, and that is, hey, I've warned you what you're doing. Please sign this document that you know that I warned you what you're doing is breaking HIPAA law, and that I'm not going to be held responsible for what you did or did not do. Okay, that's a great. That's a good approach for that kind of scenario. So the next question, what are the 6 audits? So actually 2 things. What are the 6 audits? What I'm going to do is I am not going to, rather, because we're at past time, I'm not going to read off the 6, but there are definitely 6 specific audits. You can hit up our website and we'll explain them to you. I'm pretty sure there's a listing of it on our site. What they do is they do break down into administrative and privacy. What you should do for the other thing that a couple of folks asked us is, what is my email? So you can just, our website is, most of the things you hear me talk about are actually alive, are available on our website and for free. You don't have to be a client. They're actually there, anytime you need it. Okay, but I do know that if you market compliancy group, and we will do our best to give you that what you need. So, all right, folks, we are past the hour. So what I'm going to do is thank you very much for spending time with us. If you do have specific questions, feel free to hit us up, as well as feel free to download the security and compliance checklist. As I said, for folks that have attended this, if you do end up signing up with us, we will give you a free PCI. We will give you PCI for free as well. Okay, so everyone, I really greatly appreciate your time. Thank you for spending an hour with us. Hopefully you found it valuable. Handouts, the recording will be available in the next 24 to 48 hours. Everybody, thank you so much for joining us, and I hope you will join us again for another one of our free HIPAA education series. Thank you.